The pH of the human stomach lumen remain acidic, however the walls of stomach stay unharmed by acid. The coordinated activity of parietal cells and epithelial cells make this possible. The parietal cells of the stomach secretes hydrochloric acid, whereas the epithelial cells secrete cytoprotective mucus and bicarbonate. The mucus forms an insoluble gel that coats the mucosal surface of the stomach and protects it from corrosive action of hydrochloric acid and pepsin. Gastric acid is secreted in form of H+ or proton by the ATP-powered proton pump called as hydrogen-potassium ATPase. The secreted H+ is instantly converted into hydrochloric acid by reacting with chloride ions. The activity of proton pump is controlled by acetylcholine, histamine, gastrin, and prostaglandin. Their receptors M3, H2, CCK2 and EP3, respectively, are found on basolateral membrane of parietal cells in the body and fundus of the stomach. Histamine, acetylcholine, and gastrin stimulate the proton pump, and prostaglandin like PGE2 inhibits the proton pump and stimulate mucus and bicarbonate secretion from epithelial cells. When histamine binds to H2 receptor, it activates adenylyl cyclase and induces cyclic AMP synthesis. The increased cyclic AMP activate protein kinase, which then activate proton pump. The acetylcholine and gastrin activate proton pump by increasing calcium concentration in the cell by IP3 and DAG pathways. Antacids like aluminum and magnesium hydroxides, calcium carbonate and sodium bicarbonate chemically neutralize stomach acid and raises the gastrointestinal pH. Histamine H2 receptor antagonists like Cimetidine, Famotidine, Ranitidine, and Nizatidine competes with histamine for binding to H2 receptors on gastric parietal cells, and inhibits both meal-stimulated secretion and basal secretion of gastric acid. Proton pump inhibitors like Omeprazole, esomeprazole, pantoprazole, rabeprazole, are the most efficient anti-secretory anti-ulcer drug. They inhibit the final step of acid secretion, that is secretion of H+. These drugs get activated only when they diffuses into the acidic environment of secretory canaliculi. The activated drug covalently binds with sulfhydryl groups of cysteines in the proton pump. They irreversibly inactivating the pump molecule. The acid secretion resumes only after new pump molecules are synthesized and inserted into the luminal membrane. Hence they have long duration of action.